My name is Judy Silverman, and I am a physician and the medical director for Silicon Valley DXA. I went to medical school at the University of Washington in Seattle, then spent 27 years working at the St. Mary's Spine Center in San Francisco, treating people with back and neck and chronic pain problems. If you go to a primary care physician, they may try to measure body mass index, which is looking at the ratio of your height to your weight. But weight isn't actually the best way to assess how much muscle you have versus how much fat. And that's where the DXA scan can be helpful. If you find that the exercises that you're doing may not cause or contribute to a significant change in muscle density, that kind of information will come up on the test. If you're recovering from an injury and you have a weakness on one side versus the other, again, the DXA information will help with assessing your recovery. DXA scanning is safe. There is exposure to radiation, but the radiation that you get by getting scanned is less than the amount of radiation you get by being outside in the day. One of the things that we're really striving for here at Silicon Valley DXA is to really try to have as much consistency as we can so that over that period between the different testing sessions that you may have, we want to make sure that the changes that we see are as reflective of muscle change as they can be, which means that we want to try to have you scan at the same time of day, that it would be ideal if you could wear the same clothes between studies. It would be ideal if your hydration status could be the same between studies. And we're going to try to have the same person scan you every time you come in. We're hoping all of those will equalize the playing field. It's hard to separate Silicon Valley DXA, which is the testing site, from Silicon Valley Athletics, which is the gym and training program. This is one of the most friendly, upbeat, encouraging gyms. I think the trainers that we have here are extremely thoughtful. And when we started talking about bringing in the DXA scanner, we were really able to integrate how do the trainers envision using this, and how do I as a physician get my 2 bits in? And I think that's been really helpful.